Welcome back to Well and Worthy Life. I'm super excited to have my functional medicine doctor back with us today. We got so many great questions when I polled the Instagram audience. So, Dr. St. Petery, thank you so much for joining me again today.
Thank you for having me. I'm happy to be here.
Gosh, I think this is the third podcast we've done together, isn't it?
It is. It's becoming a routine. I like it.
It is. It
Yeah.
is. And so we're going to link the other two episodes. And so we're going to talk about some things that we have talked about in the past, just because I do think some of these things need to be reiterated because I don't think people maybe understood everything. So anyway, so we're going to
Okay.
go back there first. And I get this question all the time, and I'm sure you get this question, and I think we have addressed this question in our previous episodes. But let's go back here. What is functional medicine?
Okay. So functional medicine it's a different approach to medicine. It's actually going to the root cause. It's asking why. Why do we have this? Why do we have hot flashes? Why does our leg hurt? Why does our belly hurt? Instead of just separating us into different parts and sending you to one specialist and then to another. I'm a person who likes to know why and try to understand. And it's really nice because in functional medicine, we really base a lot of the thought processes on that the gut controls our immune system, which it does. It controls our neurotransmitters. So that means that it controls a lot of different parts of our body just based on our food. So we can use diet, which is a really nice thing. But in general, functional medicine is root cause medicine. It's looking at why and trying to get to the bottom of it, which is more satisfying for a lot of people, including myself.
Oh, it's so much more satisfying. And therefore you spend more time with your patients. I mean,
I do tend to spend more time.
yeah,
Yeah.
definitely. So most functional medicines doctors do not accept insurance because you have to go through, if y'all don't know that are listening, I was married to a doctor, so I know there are so many hoops to jump over with insurance and everything else, and that you're not able to spend the time. So just so you know, most functional medicine doctors, including you, do not take insurance, correct?
Correct. And we're actually shifting our practice to insurance only just because insurance is so taxing. And as a small practice, I'm a single practitioner. So it's just difficult to have to deal with giving 7% to a billing company and having to play their game. And it interferes with my ability to concentrate and spend time with patients. So we're actually going to allot more time for those patients who are able to do cash. And it's unfortunate. I don't want to eliminate or exclude people, but it's a necessity. And honestly, I think you end up saving money in the long run. You know, the insurance companies penalize me really more for ordering testing. So like if a patient comes in functional medicine, we like to do nutritional testing, stool testing, and I've been penalized over the years, especially by Blue Cross for ordering those types of tests. And they actually threatened to take away my ability to be a provider if I ordered any more of those tests. So we just have to change the pattern. And then unfortunately, that means cutting that out. But a lot of patients, when we order those kind of testing, we get to the root of the issue. They're able to replenish nutrients or balance their gut microbiome. And then they're actually healthier. They don't need surgeries, they don't need hospital stays. And it seems like we should be rewarded for that, you know?
Yes, it does
So
seem
it's
like
messed
that.
up. If Blue Cross is listening.
Oh, it's so crazy. It's really crazy how insurance does work. And, just a pill doesn't fix it, surgery doesn't fix it. And yet that's
Right,
the way our traditional doctors are taught.
right.
So,
It
and I
is.
hate that. I really do, because I think getting to the root cause and understanding, I think there's a lot we can do. And you and I've talked about this. Food is medicine. And
Right.
this gut thing, I mean, I don't know. It hadn't even been talked about as much. Probably when did this really that they really started understanding the gut relationship,
Um,
the gut and brain thing?
You know, that's a good question, and I'm not going to claim to know. I'll tell you when I became aware. Maybe that's more helpful. I think I started in 2011, I went on an Institute for Functional Medicine conference, and I heard David Perlmutter speaking, who's a well-known neurologist who wrote a book called Grain Brain,
Mhm.
and who actually is really knowledgeable as far as diet and how diet and nutrition really affect that. So I want to say it's been probably in the past 20 years has really evolved. And I would say in the past 5 years, it's really caught on fire. And I think the internet and smartphones have really made this much more accessible to everyone. Even when I was in med school, you didn't have access to that kind of information. Social media has really accelerated the knowledge process. So I get a lot of patients coming in now who have read something, they've read books, they know things, they've already tried things, which really helps me out. Some doctors feel threatened by that, but I feel like it's actually beneficial. I don't have to teach you as much. So
Right.
it's a good thing. And like a lot of the work you do is really beneficial for patients. It educates them,
Right,
which I like.
right. Yeah, and I mean, I think the more we can learn, the more empowered we can feel to be a part of solving our problems. I mean, nobody
Absolutely.
knows ourselves like we know ourselves. And I always tell my clients, we have to advocate for ourselves and not just accept.
It's so true.
Yeah.
It's so true. There's a lot of patients I'll see who have been told by a doctor they needed surgery when really they need to go to PT, and
Mm.
they need other options, like we can do injections with stem cells, or we can use peptides. There are a lot of things that we can do that, it's a partnership. That functional medicine is a partnership with your physician. I'm not claiming to know everything. I'm family practice trained, so I'm not going to pretend like I'm an expert. However, I do have experience and training, and have worked with patients. And there's a lot of information that we've learned that isn't necessarily documented in studies either, because it's not a big pharmaceutical industry. So it's really fascinating. It's interesting. It's fringy to some people, but it's actually really fun and rewarding. So I like it.
Okay, so and I know everybody's going to ask me this, how do you find a functional medicine doctor?
So my training is with the Institute for Functional Medicine, or ifm.org. And if you go to that website, it lists practitioners in different areas. There's a little place on the top that you can, figure out where there are doctors. I get patients that ask me all the time, well, where's one in my state, or I'm moving here. And it's a really good site. So ifm.org, I think, is the premier and the best as far as training. There are probably other sites too. I think Dr. Andrew Weil has a functional medicine training group as well, but that's a pretty good place to start,
Okay,
where
great.
you'll get a
We'll link that.
legit, really a certified practitioner. Like I had to do a board certification with them to get
Right.
that. So you can look for the IFM CP, which is the IFM certified practitioner marking on their title too.
Awesome.
Okay.
Yeah. And
Yeah.
we had linked that in our previous podcast, but we're going to link that again. So, guys, y'all can go to the show notes, click there, and find one in your area. Okay. So, you mentioned peptides, and we've talked about peptides,
Right.
but
Yeah.
I get questions. In fact, I had a reel go viral on Instagram about peptides, over 2 million views. And unfortunately, it wasn't, reels are the short little Instagram video. And so you can't really show everything and tell everything. And so people were very confused as to where can they get these peptides? Can they order them? And
Right.
and then some people even thought it was like collagen peptides is what I was talking about, and that's not what we're talking about. So can you give a little bit more information about peptides?
Okay, I can definitely try. Peptides are interesting. So peptides basically are small chains of amino acids if you were looking under the microscope, and if you want to be really technical. All right. Amino acids are from, when they're made together, they make up proteins when there's enough of them. And peptides have different uses in our body. We naturally produce them. As we get older, we don't produce quite as many. And sometimes the cells start to slow down as far as their ability to be rejuvenated. So peptides have been a great secret for us to use as far as anti-aging, as far as healing, as far as weight, even things as far as diabetes. So I think I mention this every time. Insulin was one of the first peptides, and most people know what insulin is. It's an injection that you do subcutaneously in the skin to control blood sugar. So that was probably one of the earliest peptides, but there are other peptides. I actually have some of mine here. I have a new one to start that's ipamorelin and CJC. And that's one that's stacked together that basically are growth hormone analogs. So they're, it's a solution that we inject that basically tells our body, hey, let's start producing a little more growth hormone like we did when we were 25 or 18. And it turns the cells back on, but it's safe. It's actually considered an anti-cancer agent because cancer cells actually require, they stop listening to the message from the nucleus, from the DNA. They're programmed to die if things go wrong, but cancer cells don't. So this is nice because it actually turns the cell back on to listen to the proper DNA and whether or not it should live or die, which can be a little bit confusing. So I don't know if I'm going off on too much of a tangent, but basically peptides are helpful for hormone balance, for a lot of things that your viewers are particularly interested in rejuvenation and feeling good and maybe getting rid of the last couple of pounds of belly fat. And I actually have a different peptide here, Deanna, that I was going to tell you about. That's called C, which is anti-obesity compound. Not that you need this, but I'm going to try it just because it's a cream that you apply twice a day to belly fat or to an area that you don't want.
Wow.
And supposedly it's supposed to target and help burn that. I don't know. So we might want to experiment on you and see how that goes. So I
Yes.
have a friend who I've
Yeah,
using that
sign
too.
me up. You know me.
And it's a cream. You don't have to inject this one. I was like,
Yeah,
okay, I'm going to
even
try this
better.
one and just see, because when we get to menopause, which I'm in menopause, I think you're
I'm
menopausal, right?
postmenopausal. Yeah.
So, our cells don't work as well as they used to, and metabolic rate slows down, which I think is one of the things we're going to kind of talk about today too. So does that answer your
Yes,
questions? Is that a
yes,
good place to start? I don't know if I answered about where you can get peptides and stuff like that. So I don't
yes.
know
Where
if
can you get peptides? Because that's where
so
everybody's like, well, I've got to order my peptides.
yeah, because this is one I get a lot of, and I see a lot of misinformation out there. So peptides can be prescribed, by a lot of different providers, and I know Birmingham has providers, and actually Deanna you have kind of set me up where I have patients that call all the time, and I appreciate that. And I actually had a woman from Nashville who called and said that they didn't even draw blood work on her. They asked her a few questions and then they're prescribing for her. So I would like to say that peptides, while they are extremely safe, and yes, you can go online and order them, but there are a couple of things you want to know. Like, where did it come from? Were the peptides made in China? Because I'm pretty sure I don't want peptides from China. I don't know about you, but they have a lot of toxic chemicals and dangerous substances, and you're not necessarily guaranteed to get the ingredients. So, that's one thing that's really important. And then the second thing is you need to measure lab values. Like there's something called the IGF-1, which is the insulin-like growth factor. And that's a really important marker. You also need to look at kidney and liver function. Like nobody gets through my door and gets anything without some type of lab work. It's just necessary because while it is low risk, you're not doing a good job. If you could overstimulate, you could turn things on too much. A lot of patients will, just inject, not a lot of bodybuilders and weightlifters and a lot of DIY people will experiment. And, that's all good and well. But as far as good practice, you want to go to someone who has had some training. I mean, I don't have a certification in peptides, although I've done a lot of training with the American Academy of Environmental Medicine and with the IFM. But you want to make sure it's from a good place. And there are only 4 pharmacies that are actually accredited by the International Peptide Society right now. And so I use one of those 4 pharmacies because they have good quality, they have good practices, they do third-party testing. Okay, so that's the general gist. But you can walk into a clinic here and get peptides and no one's going to check your blood work because it's a moneymaker. Okay, so you have to find a doctor who's interested in your health too. That's really important. Like I guided this woman, she didn't even know how long to do it. She was just going to buy another bottle. And, it's unfortunate that people don't spend time. And I think that is a product of the insurance industry, unfortunately,
Mhm.
as
Yeah.
well as we just want to make money.
Right. And here's the thing, we all want this quick fix, right? But we know
Right.
that, I use the peptides and I love the peptides and I'm all about improving my health. But yeah, I want to make sure my levels are staying correct.
Right.
And so I use your guidance and your expertise because I couldn't spend all the time to research and know and find the right places to even get the right things. I want to know, and that's why I think it's really important important to partner with your physician and really, trust. Like, I trust you completely. I know you wouldn't get me to try anything that you wouldn't try yourself,
Exactly.
and so, and I think that's really important, and really important to not just look for a quick fix, but realize that it is a combination. It's, I mean, people ask me, well, was it, do you think the peptides have made a big difference? Yes, I think the peptides have made a difference. My hormone therapy, along with it, the way I eat, the way I move my body, my mindset, all the things. That's the unfortunate thing. I think we all want just this quick fix, and if I can take a pill or take an injection, I'm going to be great and lose all the weight. Well, that's not sustainable long term. And so I think it is important for all of it. So
It's true. I agree. I mean, I think a lot of people, that's the other thing to say about peptides is they take a while. They take a while to see the difference. Sometimes patients don't notice anything. I have a few who are really sensitive who notice stuff immediately, like better sleep. But it took me a while to notice things. But, it's definitely not a quick fix, and it's not a single solution. You've got to do the lifestyle. With functional medicine, I mean, it's about lifestyle. It's not just one single thing. I have wealthy patients who come in and all they want to do is buy supplements and do IVs, and they don't want to change their lifestyle and their thought process. And that's not going to work. I'm someone who's been through health issues, and I had to change my lifestyle and change my thought process, and it's still a work in progress,
right.
So you have to be in tune with that. You have to be committed. And that's why a lot of the things that you do are really fabulous for guiding patients. That's a really important step, is every day what you can do.
So this one said, she says, I get BioTE pellets, BIOTE pellets for testosterone, but
Okay.
your peptides fountain of youth is better. Thoughts on that? Pellets versus, I guess it's really pellets versus peptides. You could
So
do
I don't think that they're independent. So what she's talking about is just getting pellets for her hormones. Like there's bioidentical creams, which I use in my practice a lot. But there's also pellets where you get it implanted under the skin, which is really great for a lot of people. I just don't do it in my practice. It's not that I'm against it. I just haven't added that to my practice yet. Maybe I will, but pellets are great. You insert them under the skin surgically in an in-office procedure, I think 5 minutes to do, and they're good for about 3 months for people. So they keep the hormones pretty level, which is what people like. Other people can just apply, topical creams. You just have to do it every day. Sometimes that can be a nuisance, but it's just a routine. So it's just a matter of what you're wanting to do. But as far as one being exclusive of the other, I don't really think of it that way. And you and I even talked last time about, well, maybe you can come off of your hormone replacement eventually, but that really hasn't happened. And I think that's because peptides don't overdose you. They're not going to make you 22. They're going to turn the cells on gently. They're going to reactivate things. So you should get a little better libido, a little deeper sleep, which is going to in turn make the pituitary work better, which is going to in turn make the thyroid work better, which is going to in turn make the hormones work better, right? So it's an additive domino effect. And you probably could decrease your dose. So maybe the pellet dose would be less. Maybe that person won't need as much, but I don't really think that they're mutually exclusive and you do one versus the other. Now, maybe if that's their only problem, then probably hormones are all they really need.
Right.
You know?
Right. How do you start to figure out what your hormones are doing and how to balance them?
So
I can answer this one, but go ahead.
you do it then.
Well, I mean, I would say you got to go have blood work. I mean,
That's right. Blood work is important. And then there's also, there's saliva and urine testing. Like the Dutch test is one test that we've done on you. That is a dried urine test. That's actually probably one of the top tests for actually getting hormones and cortisol. But you also are going to need blood work to look at kidney and liver function, as well as to look at thyroid and to look at your insulin-like growth factor. Okay, so those are probably the primary. So it's a combination, not just one thing. And once you get those, then you can make an educated decision. Like with you, we got your IGF-1 baseline. We want to make sure it's normal. If it's too high, that could indicate that there's something, abnormal cellular growth like cancer or something, or too much protein in your diet or whatever. So we have to make sure the levels are okay at baseline, and then we make sure that they're okay at every 3 to 6 months. And so that's pretty much the technique. Okay.
So when you talked about protein just a minute ago, I was like, I'm hearing all on Instagram right now because that's where we get our our information, right?
Right? It's loose.
Is prioritize protein. We need to be getting protein, 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 protein. And I do believe that. I do think protein is important. But so, what do you recommend your patients get when it comes to protein? I mean, women my age, like 50 and over.
I don't have a number. I usually have the patients take their food journal for a week
Mhm.
and go through and calculate how much protein, how much carbs, get their macros, right? How much fat they're getting every day. Because usually there's an issue, like maybe they can't get their A1C down, or they can't get their blood sugar controlled, or they can't get rid of belly fat. So I have them calculate that and their calories every day for a week. And
Mhm.
then they go and figure in, and then they'll tell me. So, as far as protein, I do think that a small portion of protein with their meals, with each meal, is important. But I think that the paleo, excessive amounts of protein is not necessarily beneficial. And then we've got people who do carnivore, so there's a ton of different diets. There's different numbers for people. So I don't give people a set number. We kind of base it on their weight, their BMI, how happy they are as far as their shape and fitting into their clothes. And you've got to remember this too, that excess protein, your body will take protein and turn it into carb. It can actually do that, which sucks.
Yeah,
So it can
exactly.
kind of screw you over when you're doing low carb. I do have those women who they do nothing but protein, and they're like, I don't eat any carbs. And well, your
Uh, and
body's not happy with that.
that's
Women
not
aren't made for
even
that.
sustainable long term. And our bodies
Yeah.
need those nutrients from carbs too. I mean, I'm
Right,
a big believer that like
right,
berries, I mean, all those micronutrients, we need that.
right.
Uh,
Right. You need a little bit of everything. People do that usually when they're sick, when they have something wrong, with their gut and they've got to make a change, but it's not
right,
a long term. I mean, we have to think ancestral health. That's not how we evolved. We didn't start with, only eating meat. We probably went from nuts and berries for a while. We had a kill, we ate that, snout to tail. Then we moved on back to some, greens and dandelion that we found, whatever. That's really
right.
how it is.
Yeah. And
So.
then along the way, we came up with a ton of processed foods and chemicals that I'm like, oh my God.
Yeah, donuts fell out there somewhere. Right.
This was a good question. I hear this a lot. I'm
Yeah.
50, I have no energy. How much do hormones affect our energy level, or do they?
For sure that they do. I mean, our hormones are, I think I always say this, there's a triad. We have our sex hormones, we have our thyroid, which controls our metabolic rate and energy production, right? So bingo. And
Mhm.
then we have our adrenal glands, which control our stress and how we deal with stress, and some of our sex hormones. And so that it's like a three-legged stool. It has to be balanced. If one of those is off, so if you're fatigued or you're stressed all the time, then the other two are going to overcompensate. They're going to work really hard. So they're extremely important. Hormones are key. Yes, we do stop naturally producing. And so some people are like, well, that's just how God wanted it to be. But I think realistically, we live longer than we used to because of modern medicine and because of, our houses and our food and the accessibility. So we've changed things faster than our genes can really change. The
They
hormones are for sure, they're a big cornerstone. So, I think the people that think that, well, you shouldn't replace hormones, I'm not saying everybody should replace hormones, but it definitely, as someone whose hormones got suddenly taken away from them, it for sure changes your thought process, your energy, your mitochondria's ability to produce energy. So yes, it's a cornerstone for sure.
Yes. Yeah. Okay. This is a good question. This happens to me. So she says, is getting up every night to go to the bathroom normal, or do I have an overactive bladder?
That's a tough one. Our bladders have receptors for estrogen. Okay. So that's one of the things. And as we get older, when we don't produce hormones, our estrogen receptors are not filled. Okay. And so I think that that's one of the big things, is that the bladder doesn't work as well. So we have a lot of overactive bladder. We have a lot of urgency to urinate. And the other part of it would be if you drink a lot of stuff, but I don't think that that really works. Like a lot of restricted drinking, sometimes it works a little bit for most people, but I really think it has to do with our hormones and the loss of that reinforcement to the bladder. So
Mm.
no, it is a typical thing, but it is not normal in a healthy, balanced person. Okay. So
Mhm.
I think there are things that can be done to help that for sure.
I do get up every night to go to the bathroom, but I can go back to sleep. So
Right.
that
And is
wouldn't
it
be like
once, is
an
it five
overactive.
times?
Well,
No, I
mostly
mean,
most of the time it's once if I'm sleeping good. My
yeah,
problem is if I wake up and I'm like, I feel maybe like I'm gonna go to the bathroom, my best bet is just to go to the bathroom so I can
right.
forget about that and go back to sleep.
Right, right. Not lay there and think about it. Yeah. And I think once is pretty typical. Twice is where, maybe it's more disruptive to your sleep. And that's where we can consider things like hormone replacement or vaginal estrogen. But once is pretty normal for most people.
Okay. Okay. Is there a difference in taking estrogen through a patch or a pill, and which is more effective?
Yeah, so oral estrogen or by mouth, which would be a pill, I will not prescribe. I feel like it is unsafe as a cancer survivor in particular. But long before that, I've been trained that is it goes through the liver, it goes through first pass, which means that it's broken down and you get some byproducts that can cause cellular damage and cause other problems, interactions, versus a patch is much safer. And then there's the cream, which I feel like is probably the safest. So that's what I preferably use in my practice, is the topical cream. You can control the dosing, you can control how often you get it, whereas the pill, I just don't like that at all. There's also the pellets, which I think are also on the same level as doing a transdermal cream or a patch. They're a lot safer than taking a pill. It goes through the gut, it's broken down, the liver processes it, you get metabolites that are undesirable.
Okay.
Okay.
Okay. Yeah. Okay, how do you this is my question because and I've heard this before. So thyroid dysfunction and perimenopause kind of mimic one another. So how do you know the difference between the two?
And that can be complicated. And that's where labs are really important. It's funny when our hormones go down, what we'll find in a lot of perimenopausal women, which perimenopause is when you're going through menopause, right? It can last anywhere from a year to 8 years, and it's basically that time frame when your periods are kind of coming and going. And what will happen is if your estrogen levels are low, your thyroid's going to try to overcompensate. We think of that three-legged stool again, right?
Mm,
Where we've got the adrenals, the hormones, and then the thyroid. And so if the estrogen level is low, the thyroid's going to go, hey, let's make some more thyroid. We're going to try to rev things up. We're going to try to make these cells make more estrogen. And
mhm.
that doesn't happen. So you can look at lab values, you can look at the thyroid, and I'll see a lot of perimenopausal and menopausal women when their thyroid is really trying to compensate and they never had a thyroid problem before.
Mhm.
So TSH values as well as other thyroid values, and then looking at hormones. So you can do blood or saliva or urine hormones to tell all that. If estrogen is too high, it'll go back and turn off the thyroid. So they kind of go in different ways. It's really interesting. So you have to have someone who's going to look at all the labs. You can't just go in. If you have a doctor who's giving you a blood draw and it's 2 vials of blood, they're not they're doing a screening. They're not really looking very deep. I'm not saying that it's not good information,
Right.
but I'm known for getting at least 12 vials of blood from every patient. And there's a reason for it. It's not because I enjoy torturing people, it's because we need that information.
Right.
It's useful, and most patients really like to know a lot about themselves, so they're okay with it. But
Yeah.
yeah, it's perimenopause and thyroidism, they interact with each other. It's a really good question, and it's a tough diagnosis sometimes. But
Uh,
perimenopause, you don't have period. I mean, you're having periods, right? You're
yes,
still having a
right.
period, whereas menopause you're not. So
Right.
that can be a distinction.
So let's go back to these periods, because one of the things that happened to me, and this was way before I got to you, but is that I started having really heavy periods. My mother had had really heavy periods, and I hear this a lot from my clients. They start having really heavy periods, so they're like, do something about it. They're like, I gotta, either ablation or birth
Right.
control, or like me, I got an IUD, which seemed
Right.
to work just fine for me. But I have heard some people say that no, that's just covering something up. What is that when we start having these heavy periods?
That is just the surges. So what happens is the ovaries, they're sort of tanking out. right? So they're going to overproduce for a little while and then they're going to underproduce. So you're going to have, it's called menometrorrhagia, where you have like really heavy bleeding, but it'll be irregular. And that happens when there's, excess estrogen. You have a lot of it and then you don't have very much. And then progesterone surges too. So it's really just that up and down with the hormones. It can also be external things like environmental factors, chemical exposures, plastics, pesticides. It can be cleaning agents. It could be stress. Stress can kind of turn that on too. So there's so many factors. Or if you just eat crappy, you go on vacation for a week and you eat a bunch of garbage. I have a lot of women who just regular periods are terrible the next month after that. So it can really kind of set it off. There are some little tricks. There are things you can do. There are supplements that help to kind of chew up the excess estrogen and kind of rebalance.
So, would you recommend if somebody came into you and said, okay, I can't stand these periods. I'm thinking, I've talked to my OBGYN, I'm thinking I'm going to get an IUD or I'm going on birth control or I'm going to get an ablation. How do you feel about any of those things?
So that's a good question. Ablation has me kind of scratching my head. Okay. I feel like that is now it's leaving dead tissue in the body, which I don't get that. But as someone who had terrible periods, I'm not going to say that I would have said no. I think I would have had a hysterectomy before I had an ablation. But I get it. Ablation is nice because it's a quick procedure. You don't have to have it out and you get to keep your ovaries. So, there's no judgment there. But as far as is that the best thing for you? Probably not. I think root cause here, I would probably do some testing. I'd probably take a look at, non-metal toxin testing, which is a urine test. It's a fantastic test to do. A lot of people are full of different things like styrofoam and plastics that really do act like hormones and can make that happen, make your periods terrible. So if you're drinking out of a plastic or styrofoam coffee cup all the time or the lid from Starbucks, you may want to think twice about that. That's probably affecting your hormones.
Talking about that
Right?
lid, I saw somebody do an Instagram on that. They were like,
Uh-huh.
do not drink out of that lid. And I'd never even
Yes.
thought about that part.
Oh yeah.
Yeah.
Yeah. So there's the lids, the styrofoam, people that work in the hospital, they're always drinking out of styrofoam. And when you order the takeout, you've got styrofoam. So it's inevitable. You're not going to be able to
Right.
avoid it. But if you have a daily routine, you got to make some changes. You want to think about that. So back to the ablation. I think that's last on my list. I think an IUD. So there are thoughts on an IUD. An IUD is an intrauterine device. It's basically like a paper clip, smaller than that they insert in the cervix that it doesn't allow implantation of the sperm, right? So you can't get pregnant with that. So it's a really nice tool. They have copper IUDs that have absolutely nothing in them. The copper seems to really stimulate that inflammation. So yes, you're causing some inflammation, but an unwanted pregnancy is a huge deal. And so it's really important. As far as the damage to the body, I think it's pretty minimal because you probably are done having children or you're planning to have children later. So IUDs are great. They can be uncomfortable for some people. Some people can feel them with intercourse. Some people have a lot of cramping and pain with them. Now, there's a lot of IUDs like the Mirena, and there's another one, I forget the name of it, but that are laced with progesterone. And progesterone basically makes you stop having periods, right? And so there are issues with that in that it can overgrow the uterus lining, which could, set you up for some type of cancer. It could throw your hormones off balance, right? Progesterone is in a pathway where it goes down and it gets converted to other hormones, to testosterone and estrogen. And for people at risk for things like hormone mediated cancers, it can increase your metabolites. So you want a doctor who's looking at those metabolites. I always check 3 different forms of estrogen. One of them is estrone. That's called bad estrogen, to make sure that those are okay. People who are at risk for breast cancer or other cancers, their levels are going to be high. My levels were very, very high, and I didn't know that that was an issue for a long time. And there are ways to balance that and still use the hormone products. Okay. And then birth control, again, that's an oral form. I don't like that. Okay. But it's a necessity for some people. I was on birth control for many, many years. So I get it. As far as hysterectomy, I think hysterectomy is first choice for me. It's the most
Really?
yeah. And that's someone who had bad periods. Would I leave my ovaries? That's a really tough one. You got to look at your family history.
Mhm.
If there's family history of ovarian cancer, get them out, obviously. Otherwise, I think having an ovary is really important as far as it still produces hormones. Even post-menopausal, you're still going to have very minor low-level production. That answer the question,
Yeah,
or is
that's
there
it.
anything?
Yeah, I like
Okay.
that. Okay. What do you see that helps women the most going through perimenopause, those years? Is there one thing that helps them the most?
There's probably not one thing. I do think that, diet and lifestyle are really critical, being aware that this is just a time period, it's not forever. Acknowledging that, yes, this is what causes those symptoms. You're going to have erratic mood swings, you're going to have irritability, you're going to have pain, you're going to have fatigue, you can't sleep, your libido might suck or it might be really good. And it's just sort of a roller coaster. And knowing that there are things that you can do about that. The lifestyle changes, I think sweating is really important. So exercise, there's actually information that Tabata style exercises, which is, I forget what Tabata stands for, but it's one of those CrossFit type things where, for 8 minutes straight, you exercise for X amount of time, and then you take a minute break, and then you go back and do it. That type where it's not high stress, right? It's not shooting cortisol up, but you're actually, say, jumping rope, or you're doing burpees, or you're doing, push-ups, or whatever you want to do, kettlebell swings or lifts or whatever. It can be anything, but that style, you kind of know that there's an end to it. So something like that, I think you get a lot of people in their perimenopausal stage who are doing CrossFit. And I love CrossFit. I've done CrossFit for a long time, but I think you have to kind of cut back some of that high stress stuff, so high intensity where it's short bursts, I think are more appropriate, and don't do high intensity every day.
Yes.
You need to go and walk. Sometimes I walk my dogs and I feel like I'm stressing walking them. I'm like, you freaking need to stay here, and you're pulling, and I'm in a hurry, let's go. And so you have to kind of also practice being mindful and being present. So it's a whole combination, but I do think that exercise is beneficial. I think that hormones are beneficial. I think that checking your levels and nutritional replacements, IV therapies like vitamin C and Myers cocktail and detoxification. So I don't think there's one thing that helps, but I think that finding a doctor or someone who's going to take a look at your lab values and work on trying to replace things that are missing and balance. It can be balanced. I guess that's what I would say.
Yeah. Yeah, I love that. Now, what about, and you are the best person I know to answer this question because you have had breast cancer. And what about hormone therapy and breast cancer?
So hormone therapy and breast cancer is very controversial. And, there was a doctor named Dr. John Lee, who he still has a website that you can look at. And he wrote a book about breast cancer and what your doctor won't tell you. And there's a lot of data that taking progesterone, so using like a topical progesterone, it actually reduces the need for estrogen. Progesterone is very calming. It actually hits the receptor in our brain called the GABA receptor, which is what Xanax hits. This is why we like progesterone, because it makes us sleep, it makes us calm. If you're menopausal or you go through cancer and get your hormones cut out, then your progesterone drops. And so you don't sleep as well. That's definitely the curse I have, is trying to figure out how to sleep. And you have to look at, the receptors, the estrogen receptors and the progesterone receptors, and are they positive? And then it's still controversial. Me personally, I don't have myself on progesterone, although I probably could. I'm a little bit afraid of that still, but I have breast cancer patients who want to be on progesterone and are on it and are great and have lived 20 years and are fine. So, it really depends on the patient. It depends on their history. It depends on their numbers, the risk of it. Like with my cancer, we got DNA that told me that it was very slow growing, unlikely to recur if we removed it, and if we did X, Y, and Z. So there's a lot of information there, but it is possible. As far as DHEA, I don't use that in breast cancer patients. But as far as progesterone, I do think that's possible. And I do think peptides are useful instead of hormones. So I tend to go more in that direction. And I definitely do not use estrogen in breast cancer and cancer patients.
Well, honestly, that's all my questions, I think. I'm like, oh my gosh, we did
I was
good.
worried you'd ask me something I couldn't answer, so that's good.
No, these were really good. And I just think that, I get these questions all the time because, I talk about you all the time, and I talk about how thankful I am for finding you and for all the things that you do to help me you know, people will say to me, gosh, you don't seem like I'm about to be 57 next week. And I don't feel that old. I mean, I feel young and energetic. I do have some aches and pains sometimes. I'm like, dang. But for the most part, I feel really good. And I really think it's the everything that I practice. You know, it's not just the hormone therapy, not just the peptides. It's the combination. It's a combination with working with you and show and seeing where my values are. It's something that we have to be proactive about. And I've told this story before to my audience, and I think I've told you, but before I found you, and I would go to my internist and they would draw lab work, I don't even remember going over my lab work. I don't
Yeah.
I don't
Yeah.
ever remember anybody calling me. I think they would have
Yeah.
only called me if there was something wrong.
Yeah.
And I wasn't really concerned about it. Didn't even dawn on me. You know, I think when we're a little bit younger too, we think, ah, we got this. We're gonna live forever. And it wasn't until I really hit that 49, 50, 51 mark for me, and I was getting closer and closer to the age both my parents had cancer, and then my father even passed away, and it became more important to me that, like, I better do everything I can to
Right.
have longevity. So anyway, but
Yeah. I think you came to me pretty well balanced, but it's been nice to kind of watch what you do and add to it and help you to improve. So I think you have a good approach. I think your listeners are really lucky to have you.
well, thank you. Thank you. And then they can always call you. Let me
Right.
ask you this, because my audience is all over the country. Do you do telehealth?
I do. I sure
Okay.
do. Yes, ma'am.
Okay. So you can, somebody can call in from Washington, DC or whatever, right?
Right, right. I think we've had people from other continents, and I can't do that. We had somebody from your show from from Australia. And
Of
I was like,
course.
I don't think that I can do that. So I didn't feel comfortable with that. I can talk to them, but as far as prescribing, I can definitely talk to them. Absolutely.
It's so funny. I know. I mean, I'll get people from Australia. And the other day, I
Mhm.
was talking with somebody on Instagram. I'm like, where do you live? And they were like, Ireland.
Yeah.
I'm like, oh my gosh. It's
Yeah, it's
crazy.
crazy. It's crazy how much bigger it gets. Yeah. So it's interesting. But yeah, we take new patients and we do telehealth. It's been great. COVID has really made that a possibility and kind of opened that door up, which has been fantastic. So yeah.
That's awesome. Well, Dr. St. Petery, I'm going to let you get back to work. And I just appreciate you so much for joining me today on the podcast.
Thank you for having me. Take care.